Hello. Hello.
Hello. Can you?
Hello.
Yeah. Okay. We all good. 1 minute to go.
Okay.
All right. Hello. Yeah. Okay. We all good. 1 minute to go. Yeah.
Okay.
All right. Hello. Yeah. Okay. We all good. 1 minute to go. Okay. All right. Hello. Good afternoon, ladies and gentlemen, joining us via various social media platforms. Welcome to Dr. Fundi channel, a channel that's dedicated, to discussing matters of health and wellness in our country. Today, we have a special guest. Our special guest is Dr. Noluthando Nematswerani. She is the head of the Center of Excellence at Discovery Health. The Center of Excellence within Discovery Health falls under the Strategic Risk Management Division. Now, she is a qualified medical doctor who obtained her MPCHP degree at the University of Natal, now called UKZN. She went further and studied and obtained masters in clinical pharmacology from the University of Pretoria. She also obtained masters in biostatistics and clinical epidemiology, also from the University of Pretoria. So she's been a doctor for more than 20 years. We have invited her to join us here today because she comes from Discovery Health, which is the biggest medical aid in South Africa, and also, the biggest medical aid administrator in the country. So when one wants to have a feel of what is happening in that space, it makes sense to invite somebody from Discovery Health. And so, Dr. Nematswerani, welcome to Dr. Fundi platform.
Thank you, Dr. Nyati, and thank you for the invitation, and good afternoon to all the viewers and listeners.
Thank you very much. Doc, as I was going through your bio, there were a number of things that were listed under your responsibilities. So before we get to the actual, topic or the business of this discussion, I just want you to just give us a sense, of what are your responsibilities within Discovery Health. Yes, you are the head of the Center of Excellence, but just unpacking this health technical assessment, surgical risk management, clinical policy, just unpack those things in simple language.
Okay. Thank you so much, Dr. Nyati Fundi. My unit is the Center for Clinical Excellence. So we lead the clinical strategy for the business. So we look at Discovery Health, which is the company that I fall under, but obviously the bigger Discovery Group, which includes other businesses as well. So we do have input across the various businesses. So the units under my broader unit are the health technology assessment. So this looks at all new technologies that come through the business. So if there's a new drug, there's a new technology, there's a new procedure, new device, it comes through to our unit. We'll do a clinical evaluation to see that there is evidence that is supporting that particular intervention in terms of its use. If we are comfortable with the clinical evidence, then we take it through a financial filter. And based on that, then we can decide on whether we want to do a full health economic evaluation. So that unit does that work. And once we are comfortable, then there is transitioning then into benefits. So we've got a clinical policy unit, which will then say, how do we then formalize that into a benefit? And then we say, we will fund only for these plans. These are the clinical criteria that will be applied. For example, the clinical policy unit also supports our chronic illness benefit in that, for example, if you've got a hypertension benefit, we need to know how often should the patient go and see a doctor, what drugs should be included in the formulary, all that. And I mean, it's broader in hospital care in terms of supporting our case managers with clinical policies for relevant allocation of benefits. So it's all around clinical, and in fact, my team is a clinical team of doctors, of pharmacists, of nurses. We've got other clinical disciplines as well working within that team. The surgical risk management is a team then that looks specifically at medical devices. So when we think about a new device coming through, they will come and look at it. If it is similar to what we currently fund for, it will be then reviewed under existing benefits. But if it is something new where there is additional clinical benefit and we've never funded it before, then it's transferred to the same unit that I spoke to you about earlier, which is our health technology assessment unit. We've got the medicines unit and also the drug risk management unit, which also fall under my team. So drug risk management is really a team of pharmacists. They formulate the formularies that we use to support our benefits. So those benefit tools are then constructed by this team. We also have, as part of that team, obviously our drug negotiation team. These are the people who interact with the pharmaceutical industry, to try and get better pricing so that we can have affordable care. We also interact with our retail pharmacy partners as part of that unit, and just formulate the broader medicine strategy for discovery. You must stop me because I can talk forever. It's all...
No, it's fine. I'm still listening. I'll stop you when it's my time to stop you.
Okay. And I think if I look at the broader strategic risk management team, we operate with other clinicians who then will have a focus on hospital risk management and contracting. So they will discuss with hospitals, another team that will focus on quality. We've got other teams that focus on health provider relations and also health professional risk and coding. So it's a broader team, but we are the clinical hub within that broader unit, informing clinical strategy for the business.
Yes, because I see that they say you are in charge of the overall clinical strategy for Discovery Health and related businesses. Now, just for somebody who doesn't understand this space very well, there's Discovery Health, all right, the administrator,
yes.
And you correct me, and then
yes.
there are the schemes that are administered. Just make it simple, for us to understand.
So I work for the administrator. So Discovery Health is the administrator. We administer 19 schemes, of which Discovery Health Medical Scheme is the biggest scheme under administration. And we've got other schemes as well, like BankMed, Anglo AMS. So we've got various schemes that we administer, but we are the administrator, the broader administrator. So I work for the administrator.
All right. Okay. But you said your clinical strategy is applied across not only on the Discovery Medical Scheme, but all the schemes under your administration.
Definitely, all the schemes under my administration. So under Discovery, Health administration. So when I spoke about, input into other businesses. So for example, Vitality is another standalone business.
Yeah.
So we offer, even though there are clinical people employed there, but we do have, input in some of the clinical strategies for alignment within various businesses.
Okay. All right. Now, at least that gives an idea of what you guys do within Discovery. and also, what your specific responsibility, is. Now, okay, I'm happy with that. Now, Doc, at the beginning of this year, we start getting to see the news filtering from China that there is a new outbreak of international concern. Within a few weeks, WHO declares it that it's a public health emergency of international concern. Few weeks later, it actually is declared a pandemic. Now, you guys are are under the risk, strategic risk management division of Discovery, right? So obviously, it must have, flickered the, amber and then red that, there is this big risk that's coming. Now, just talk to me about that. When you guys picked up that there is this big thing coming, what went through, the risk people?
So I think for us, it was, in fact, it was a company-wide response rather than just, limited to our risk team. It was really a company-wide response that says it's Discovery because we innovate. That is, at the core of what we do. What can we do to actually make sure that instead of, throwing our hands in the air and saying, here's a big crisis, how do we assist with the response? And I think I'll just take you through the steps in terms of what we started by doing. And I think in the initial stages, remember, like you are saying, this is a new virus. Nobody knows much about it. There's still very limited information out there. People are not, there's anxiety, there is misinformation. So we then decided, firstly, let's make sure that we create a content hub that is going to help our members access curated information that is accurate, that we can update on a regular basis so that there's, they can, get to a reliable source of information. We did that for our members. We also did that for our health providers. We went and looked at all the content that is available to say, let's make sure that there is a reliable point, a central point where our members can go to and the doctors can go to access this information. And this, for us, we felt it was a critical initial step in really addressing the pandemic, because you want an informed membership and you want the clinical providers of care to also be well informed around how to manage these cases, what is correct information and what is incorrect information. So I think that was the first step. And then the second step was really to say, let's look at our benefits and see if our benefits are fit for purpose. And I think when we then went to analyze our benefits, we felt that some of our benefits actually catered for patients who would be COVID confirmed, who will be confirmed for COVID disease. And these would be patients who are accessing care either in the out of hospital space and confirmed with a viral pneumonia, for example. So our prescribed minimum benefit, as per the current regulations, we're already addressing those cases. We then looked, where are the current gaps in terms of benefits? Then we said, if you've got a COVID-19 positive patient who is accessing care in the out of hospital space, that's where the challenge will be, because this person may not have adequate cover if they do not have, their savings available. And therefore, that's where we then decided to create a benefit for our COVID confirmed cases. And we called this our WHO Global Outbreak Response. And the reason why we did that, we didn't want to be short-sighted and say, because we're dealing with COVID as the current epidemic or pandemic, that when we face another pandemic, then we have to, start the thinking all afresh. What we decided was to say the thinking is that whenever we have a pandemic, there has to be some form of response. So we structure a benefit that responds to these, but then obviously right now we're dealing with this specific one, and therefore whatever we put in our basket of care is going to be tailored to this current infection. So that's what we did, and we went to the market with the benefit, which included consultations, it included pathology testing, it included a basket of supportive care. And I think this has now been formalized as a prescribed minimum benefit by the Council for Medical Schemes. And then we also looked.
Wait, Doc, a little bit, just a little bit. You're moving a bit fast for me.
Okay.
All right.
Okay.
So you guys basically looked at everything and you anticipated what might be the needs for both in-hospital patients that are confirmed with the disease and out-of-hospital benefits for people who are confirmed. Now, I'm stressing the part about confirmed. What about those who were still being suspected, not yet confirmed?
So those who were suspected, existing benefits, we said they could still be sufficient. They may not be always available, but we said they were sufficient. We needed to prioritize. And I think it's important to highlight the fact that because this is a new area, you need to almost open up benefits in a manner that is going to be sustained because remember, there is still going to be a potential increase in the in-hospital cases that are going to drive up, medical scheme costs. Let's prioritize our confirmed cases and make sure that they are covered both in and out of hospital. So I think that was our main focus. And we then looked, because remember, it was not just that, there were other areas that we needed to look into to say, in our full response towards COVID, what are these important benefits that we need to make available to make sure that our response is adequate. It may not always satisfy everybody, but at least we feel that the sick patients are going to be catered for. Because I think the priority is really the sick.
Yes. All right. So in my little understanding of benefits, the way they structure it, you've got what they call day-to-day benefits.
Yes.
You've got hospital benefits, and you also have the medical savings account. Just quickly talk around those things.
Okay, so
in relation to COVID-19.
Okay, so we've got plan types where they have got what we call day-to-day benefits. So day-to-day benefits are the same as medical savings account. Okay. So these are, there are specific plan types that will have those. Some have got limited, savings, and others have got savings that once they are depleted, they still go to the above threshold. So those are the top plans. The plans where there's a higher premium. So then there are certain plans where they don't have medical savings account. And obviously then they don't have access to day-to-day benefits. So if you are not confirmed under the current benefits, it means then you will have to pay out of pocket if your test comes back negative.
If it is negative.
If it is negative.
But if it is positive, then you take care of it.
Then you are taken care of. So, and I think that's why I'm saying the aim was to really prioritize the sick. And I mean, we costed this, it is a significant amount of money, but we felt it was the right place to actually prioritize the funding. Because remember, we were creating a new benefit that did not exist before, but we felt it was important to make sure that we cover these members in the out-of-hospital space. Remember, this was not the only allocation of benefits that we focused on. It was a group of things that we looked at and we said, maybe in this area, let's prioritize this, let's prioritize that. And then we're going to discuss some of the areas that we also prioritized along the way.
Yes, we're going to get to that. That. So I heard you mentioning that, there's this thing that you guys call above threshold, where you must pay for yourself, and then at a certain point, you guys come back and cover. Does it apply during COVID-19?
So no, remember, well, it will apply for those members who do not meet the criteria for funding. Yes. Remember, so it will be MSA, the same rules will apply in terms of accumulation to the above threshold benefit. And you are talking about that gap, which we call the self-payment gap, before you can get to the above threshold. So those rules will still apply for those people who have got a negative test. So that's why we say for some people, they may actually be in the above threshold benefit, and therefore, even though the test is negative, it will still be funded from that risk pool.
For the risk pool, yeah. Okay, all right. So then you created this WHO global pandemic, kind of benefit. What other areas did you guys look at besides, in hospital, out of hospital type of benefit?
So I think we then looked at our health professionals and we said, our health professionals are at a higher risk of exposure to this COVID-19 because of obviously of their interaction with their patients. And I think you will have seen, our launch of the virtual consults, which I think we have actually been trying to get the virtual consults, up and going for many years now. We first launched them in 2015, if you remember, but the uptake was as great as we wanted. And I think this was really the best timing for us to remind people of the importance of using such a platform. So what this platform does, it actually allows members and doctors to have, a virtual consult while minimizing, firstly, if you look at the provider themselves, you're minimizing contact with people who are already symptomatic, because we want our doctors to be healthy and be able to see more patients. Because what we see is that once the doctor is sick, then out of practice, and then it's a loss to a broader, patient population. The second thing was to also protect members who would ordinarily be going to sit in a waiting room and then be exposed to infections in that space.
Yeah, Doc, let me just I want you to move with me nicely. You're doing well so far. Now, about the virtual consultations, all right? You guys call it, is it Doctor Connect?
Yes.
Is that
the Doctor Connect? It's our platform.
Doctor Connect. Now, colleagues generally are technophobic, right? By that I mean a number of doctors in private practice, especially those who work in townships and stuff, are not very well-versed, or the infrastructure, technology-wise, is not so great. So now what happens? Doctor Connect is there. They can do virtual consultations. However, they don't have the infrastructure. Is there an alternative?
So I think for us, firstly, because this is the platform that we have created, and we believe that it offers a lot of value to the doctors, because we make certain data available around the patient to support the doctor when they do the consultation. I think maybe instead of, I'd rather, we focus on how we get people set up rather than, for people to try and, remain in their own, ways of doing things, because I think all of us are almost forced to engage with technology. I'm working from home. We are doing a Zoom, interview with you. Under normal circumstances, we would have preferred a face-to-face.
Yeah.
Circumstances are not allowing, but I think it is about saying to doctors, this is a step forward in terms of improving, how we deliver care virtually. And I think our teams are available to actually assist doctors, to setting themselves up to be able to retain their income, but, still,
working differently.
Working differently. And I think for us, we really want the doctors to be set up in a manner that is going to help them in future, in consulting with their patients and still getting reimbursement.
And now, as Discovery, you are then paying a full consultation fee that is, a virtual consultation. If there was a fee for a normal face-to-face consult, is it the same fee as the fee that you pay for a virtual consult?
It is a percentage. It's 75% of that of the face-to-face consultation.
Yes. Okay. Oh, all right. That's still good enough. That's still good enough. Any reasons that you've picked up from the guys? Obviously now this is a different situation, but the lower uptake, since you launched in 2015. Any particular reasons or trends that information you got as to why guys were not really, coming in numbers to adopt the new technologies?
I think if you listen to most of the older doctors, it will be around, you don't want to miss anything. A a virtual type of situation. But if you remember, HPCSA regulations, prior to this COVID-19 pandemic, almost always insisted that before you can do a virtual consult with a patient, you must have existing relationship with that patient, so that when you consult with them virtually, you've got that background understanding of who this patient is.
Yeah.
Right now, those regulations have been relaxed a little bit to try and accommodate, even some of the patients who may not have that pre-existing relationship with the doctors just for this period of COVID. And I think there's always been that anxiety and fear that, what if I miss something? What if, in this virtual consultation, there's some missing clinical information and I make a wrong, a diagnosis? Exactly. I think people were just worried about litigation, about really just making the wrong diagnosis based on the platform. Yeah.
Now, then you guys, there is something about a partnership between yourselves and Vodacom.
Yes.
As some health platforms. So I got confused there. Is it still the same Dr. Connect, or is it a different thing now with Vodacom? Can you just talk to me around that?
So we're still using a similar platform for the doctors to actually do the virtual consultation. But our partnership with Vodacom really is broader than just our scheme membership. Remember, now it is for the general South African public. So that the platform allows South African citizens who are not scheme members to get into this platform where they can also, get assessed by a clinician to see if they are, at risk of COVID-19 and therefore require testing. So it is offering it, but we're using the existing platforms to accommodate that broader, allocation to the South African citizenship.
And for those who are Vodacom members, there's some special number that people can call. Yeah, talk about that. Okay,
so I mean, I don't remember it all, but it's I think it's
star 111 hash.
Yes. So, and then they can then be directed. They will be asked a few questions, and then they will be directed to a doctor. So it's the triage process. The questions that they get asked, so that we can see if they potentially have got certain symptoms that then qualify them for the virtual consult. Because remember, this is a specific service that we are offering specifically in line with COVID-19. So we don't want people to just use the platform for other things. We want them to be directing their queries and also their concerns and also the review of their symptoms in line with COVID-19.
All right. So from the health provider point of view, it looks like they are sorted.
Yes.
From the members and their beneficiaries, what issues have you been picking up, and what did you guys have to address?
So I think with members, so like I'm saying, we looked at the benefit. There has been also, I think we have also launched this in the public domain around the hotels, where also as part of supporting members who are tested positive and cannot isolate at home, there's a partnership with the capital hotels to say maybe some component can be funded for by the scheme, and the rest then is the members, it can be funded by the member from their own pocket. This is really to just give some, contribution to those members who need isolation in an environment that is not a hospital, but it is still not the home environment where they could still expose their families to the infection. And I think this was really the reason why we thought of this particular offering was based on the fact that we know that there is data that shows that some of the infections run in families because it's not always easy to self-isolate in the home. So you get these infections in family clusters. So I think that's one component, but I also need to just say that the fact that we launched some of these benefits at a point that we did it doesn't mean that we don't continuously review and see areas where there may be, some reason for us to review and improve. And I think you will just need to continue watching the space to see if Discovery is going to be coming back with other things to enhance, on the current benefits that we've already launched.
And earlier you did mention, the issue about a content hub or an information hub. Is that for patients, or members and their beneficiaries, or is also for the professionals?
Yes, we've got a specific health professional zone on our website where we have actually worked hard. I mean, I was quite impressed with what the team has done to just, go and source all the relevant clinical information and, put it in one, central hub. I think we all read various articles here and there, but it's nice if you can go to one central hub and, you can go and skim through some of the articles. And I mean, we know that the other important issue here is that the information is changing so rapidly. You need to make sure that you are on top of your game with some of this information. And what we try to do is to also just make sure that the information is curated. It's coming from reliable sources. It's peer-reviewed, publications, also from WHO, from NICD. So we're not reinventing the wheel, but we are just making sure that it's easily accessible to our providers. And I think the other important thing for providers is that we also running podcasts. We're getting experts to, the first podcast was with Prof. Guy Richards, who's an intensivist. We've also run a webinar with, the infectious disease control, clinicians to try and reach our professionals. I think there's one. So we've done that in partnership with SAMA. There is one that we are going to be hosting on ethics, and so we're going to get SAMA to co-chair that with us. So I think there's a lot of work that we're doing. I think for us, it's really empowering, our clinicians with the latest and relevant information so that they feel that they are equipped to deal with these cases going forward.
Yeah. Now, so somebody then has the virtual consult, and there's a need for that person to get medication from a pharmacy. All right. Now, is it done in an automated way straight to a pharmacy, or how do you handle that part where there is a need for medication that's prescribed?
So the virtual consultation offering is not for diagnosis or medication. So the doctor is going to do the consultation, and then they can make recommendations in terms of whether the patient needs to go further and do testing. And then based on that, then they can. So in terms of, just the patient accessing, out of hospital care, they could go to a pharmacy, or, the pharmacists also offer their own services in terms of supportive care. But remember here, most of these cases would not have had a diagnosis anyway.
Yes.
So they would be referred for testing. So I think the platform is really around doing that initial assessment that will assist to determine which patients go on to be tested for COVID-19. Yeah.
No, it's because I picked up that prescriptions, if there is a need for prescriptions, because in terms of the regulations, you still need a signature of a doctor. The doctor will have to write a prescription and then either email it or fax it or take a photo of that to the patient for the patient to then go to the pharmacy. I just wanted us to close that loop.
Okay.
And also in issues where there are additional blood tests that needed to be, to be taken. I think it's a similar type of process. Yeah, we can talk about that.
So I think it's the same process, because that's why I'm emphasizing the fact that the service was really geared for, COVID-19 beyond other healthcare needs now. Because remember, for some patients, a virtual consult is sufficient. They don't require additional stuff, which is why there are patients who may need to move from a virtual consult to a face-to-face consult because of the complexity of their presentation, and therefore they may need, the additional requirements. So I think there's minimal requirement right now for the scripting and the additional stuff. But like you're saying, there may be those rare cases where you need to do it, but it must be in line with regulations.
Yes. Now, some people, okay, now maybe this is not specifically COVID directed, but some people have got chronic illnesses, diabetes, hypertension, and other conditions where they have to continue to take medications, because we also view them as high-risk patients, should they get COVID-19. And therefore, optimal management of those chronic conditions is actually quite important. So now what I want to find out, has there been any challenges with, that side of things, because logistics now are not the same with the lockdown and everything, is there any challenges that you guys had to change how you do things to make sure that those people with chronic illnesses are still able to access their medication?
Okay, so I'm going to address this, considering what most doctors and maybe some members, there was anxiety just before lockdown that, people wanted to get like 3 months supply of medications, which I think was discouraged both by the Pharmacy Association, and we also discouraged it because we didn't want people to stockpile, because that would impact on the available stock for the country. And we said, remember, accessing a pharmacy, it's still an essential service. But we understood that, there is a risk of exposure if people go to pharmacies, which is why our MedExpress offering, which is a courier pharmacy offering, is still, applicable to those members. So, we can almost make sure that their medicines are delivered to their doorstep, or whichever, area or address of their choice. And then also pharmacies did communicate to us that they'll be able to do some pre-ordering or pre-packing of meds for the patients, where you can call in as a chronic member and say, I would like to renew my script. I'm going to come in and collect, to minimize the queues in the pharmacies. It means you can pre-order and you can send a third party to go and collect on your behalf. But it's just about minimizing the queuing in the pharmacies, and also you can also get the couriering of your medication to your a preferred address for delivery.
So the side of accessing one's chronic meds is basically covered.
Definitely. So we have not had any issues. They might have, I think in the initial days, because maybe people were all wanting to get medications at the same time, we did get, some feedback that there were some delays in other pharmacies, but that was soon resolved. So I'm not aware that there are any issues right now, because I think the process is smoother and people are now, much more comfortable that, there is no limitation in them accessing their medication from the pharmacies.
So, Doc, what other benefits or things did you have to introduce as a result of this? We've spoken about the online, consults. We've spoken about the new benefits. We've spoken about a number of things. But I'm sure there's other things that you guys had to introduce or change as a result of this lockdown and the pandemic.
So I think we had to make, some provision for people who are economically challenged at this time, specifically looking at members who may have difficulty with paying some of their contributions, so that we make sure that there's continuity of cover, during this period of the pandemic. So what we've done is to look at people with a positive MSA balance. So it means there's money that you didn't use in the last year that you carried over to this year. So if you've got sufficient funds, those funds could then be used to cover your contributions during this 3 months that we have been allocated. So this was taken to the regulator for approval, and it has been approved. So I think that was really an important step in acknowledging that there may be financial challenges that members may be facing, and to make sure that those with a positive MSA balance
could be used.
Utilize that. And I mean, we also considered the small to medium enterprises, the businesses that have got Discovery Health members where they are making those contributions on behalf of their staff members, to say, how can we support them, with also, giving them some, concessions around this period in terms of, paying their contributions for the. But obviously, there are specific criteria that we apply to make sure that, we are being fair to the scheme, because whatever, concessions that we make must be such that it is sustainable in the long term for the scheme. So we look at the number of Discovery Health members within those SMEs, and we also look at, the status in terms of how long they've been with us and all that, to make sure that, we make those concessions, in a reasonable and with managing a bit of risk in that process.
And how have those concessions been, received by both the members and also the SMEs?
I think, the feedback has been positive, and I think, where there are issues, you'll find that it's maybe people not understanding how the mechanics of the whole offering works. So it's just making sure that people are clear around how it works and, where it applies and where it does not apply. But I think overall it has been very positive.
Now, there is Vitality, which is one of the business units. Now, what happens, because people are locked down, yet in terms of Vitality, people are supposed to accumulate points. They must go to the gym and clock there and accumulate points. So what happens now? Won't they be penalized that you did not meet your target of gym in your 12 months period and all of that? So I just want to know about that.
No. So because we do understand, we have looked at our data, and we do know that people are not as physically active as they used to be. But what has been quite useful, I hope people have been following Vitality. We've got a Vitality at Home offering. I think for me, I do need to highlight the fact that I think the old thinking that physical activity only happens in the gym is a thing of the past. You can be physically active anywhere, which is why we really encourage people to use devices, because with a device you can monitor your physical activity anywhere. It actually does not limit you, it liberates you to be able to run on the street, and be in an environment that's actually, okay, now you can't run on the streets because you are locked down, but under normal circumstances, you can be out there, outdoors, and you can actually with your device, measure and monitor your physical activity. So what Vitality has done right now is to actually, relax the requirements, in alignment with the lockdown, to say we're not going to penalize you. The number of steps have also been reduced to ensure that people still meet, reasonable targets during this period, but not completely be inactive while at home. Because we also know that during this time when we are, worried about COVID-19, we want our immune systems to be up and about and good and ready to fight the infection should you be exposed to COVID-19. And physical activity is one of those interventions that we know have been tried and tested and work well. So it's the Vitality at Home offering. People must really come to the website to learn more about Vitality at Home, because it allows people to still be physically active and have fun in their home environment.
Okay. Now, I think I'm covered there, Doc. There's something about doctors or healthcare professionals and a fully funded flu vaccine. Just talk to me around that.
Yeah. So I think we all know that, we are getting into the flu season. Previously, our benefit has always been to cover for high-risk members for influenza vaccination. And this is obviously based on clinical data that has shown that people who are older than 65 with underlying chronic conditions like heart, diabetes, chronic lung disease, pregnant women, and kids. So there's been that consideration based on a set of guidelines that influenza vaccine is recommended for those people. Health workers have never been covered, as part of that benefit. And I mean, you can also just look at some of the clinical data around that. But there was a consideration to be made, considering that we've got COVID-19 and we are, going into the influenza season. We would not want our healthcare professionals to be out of action because of influenza, which is why we decided let's offer something to healthcare professionals. And this is in line with the government recommendation for high-risk members to be prioritized for influenza. I think if you will note, this year, there was a high demand of the flu vac because exactly that. And I think it was important for us to make sure that the priority is our high-risk members who are at high risk of having severe influenza disease. I think for our system, I mean, our system would not cope if we had a terrible flu season and a terrible COVID-19, sudden spike in infections. And I think we want our healthcare professionals to be in action, which is why we also offered that across the board.
No, that sounds very good, Doc. Is there anything else that you want to boast about that you guys have innovated with, at this point?
I think that's why I'm saying maybe you'll have to invite me soon to just keep updating you guys as the pandemic unfolds. Like I'm saying, we're not just sitting as we start to engage with the profession, engage with our members, and also look at what a government is doing. And I think maybe to just not to boast, but to say we are also very much plugged in into the business's response in a bigger space where we are saying how do we as Discovery offer support to government in terms of procuring PPE, in terms of contributing to the Solidarity Fund. I mean, you've seen some from our execs, and it's really just a more holistic view of what is required, not only for our members and also for our clinicians and maybe even some of our brokers and employer groups, but broadly, what does government require of us in terms of support? So there is also that piece of work that is done on the side, but I think we are still in this pandemic, and therefore there's still more that we can still offer.
My last question to you, Doc. You've been talking about, using evidence-based stuff that has been researched and whatever to guide how you do things. Now, there is a study that was done in China looking at the psychological impact of COVID-19 to the general population. And what it showed was that there was about 54% of the people who were surveyed reported moderate to severe levels of psychological impact. About a third of those people, higher anxiety levels, and just about 17% depressive symptoms. So I'm bringing this to say, without dealing with the actual COVID-19, that is now the patients who are admitted, there is an expectation based on what has happened elsewhere that there's going to be a rise in mental health services, right? That are required by people. And traditionally, benefits for mental health across many medical aids have, there's room for improvement, but now, so there are those people who are already under treatment who may need augmentation of what they have. But then there are those who've never had mental health challenges, but they are now starting to have challenges during the lockdown period. So is there anything that you have done to look at that side of things? Because they may not necessarily be COVID-19 infected. However, the whole thing is impacting on their mental well-being.
Indeed, we have had discussions and we have looked at it. And I think our belief is that prevention is better than cure. And I think I'm going to go back to physical activity as an intervention that has been proven, not only just for other benefits, but also for mental well-being. Physical activity has been proven to actually improve one's mental well-being. In 2020, we actually launched a mental well-being offering on the Vitality side, which is really a risk assessment a tool that also channels people to some, interventions that are really basic. But there's physical activity there. We can look at good nutrition, but we can also look at some available tools that our members can also access. Once then a person has almost cross the line from just being at risk and now have a diagnosis. Unfortunately, right now we will still rely on the existing benefits, which are mainly regulated through the medical schemes, regulations. But I think at a time when we then start seeing, we'll do a similar assessment to see if there are existing gaps as we start seeing maybe patients coming up. And I think we are open to reviewing our benefits accordingly in line with what we see coming out of this lockdown period.
You see, because there's a lot of anxiety, like you mentioned, there's going to be more liquidations, of businesses, smaller companies, medium-sized companies. Some are going to fold, retrenchments are going to go up, and all of those kind of things. So the life events or the stressors that are as a consequence of the pandemic are obviously going to be more. But anyway, I think...
I forgot something.
Yeah.
I forgot something. So in line with exactly what you're saying, so we've got a product, a healthy company product, which we offer to our employer group. It has got a mental well-being. So there's a financial component to it. There is the emotional well-being to it. And then there's legal, and also there's just the general wellness component to it. So we would really, really encourage people to almost use that service. It's currently operational even during lockdown, to make sure that people, have got, that assessment and assistance from a person who can guide them through this process right now. So I think Healthy Company is another offering that is very useful during this time.
Is this an employee well-being type of benefit?
Yes, it is.
Okay. Yeah. All right. Norman, Doc, I want to thank you for granting me the interview. You were able to represent Discovery very well. I hope your members and your beneficiaries, your members and their beneficiaries have been empowered with the information that you have shared. I'm sure it's not the last time I talk to you, but for now, I need to thank you. We will keep checking, what's new. We get these weekly updates, and that's where I got most of the information as I was preparing for this interview. So keep on doing the good work, and you guys lead and other people follow. May you continue to do that. All right.
Thank you so much. Thank you so much, Doctor.
Okay, thank you. And I just want to say thank you to all our viewers who joined us for this discussion, because we have not really touched on the issue of the medical schemes and what they had to do. And so I hope if your scheme doesn't do the things that Discovery has spoken about, maybe it's time to advocate for them to also, do certain things so that you feel that next year you can still be with them. But anyway, thank you very much, Doctor, and thank you to all the viewers. Goodbye.
Thank you.
All right.